I chose FW as my challenging client for the second screencast assignment because she has complex psychiatric and medical treatment profiles. Despite the seriousness of her current diagnosis, she has no history of hospitalizations, neither medical or psychiatric. She also has no history of substance use or abuse, including tobacco. FW lives with her parents and her 3-year-old son. She is not in contact with the child's father. FW is currently prescribed Topamax, Effexor, and gabapentin, all for chronic and complex migraines, which she endorses having daily. FW was referred by her neurologist to a migraine specialist who is attempting to wean her off her migraine medication so that she may also be treated with psychopharmacotherapy for her depression, anxiety, and post-traumatic stress. She's only being treated for these mental health conditions with psychotherapeutic interventions because of potential drug interaction risk, especially serotonin syndrome. FW uses multiple online support groups for chronic illnesses, Ehlers-Danlos syndrome, and migraines, but she has not sustained mental health treatment support because she says she is sick and tired of people questioning the legitimacy of her medical conditions, especially as the primary source of her mental health conditions. FW has been referred to an EMDR therapy to address her history of trauma, specifically related to her multiple chronic health issues, and as a way to encourage her to build additional trusting therapeutic relationships with mental health professionals. She has also been referred to a pain management clinic. FW has an intense fear that she will have a heart attack and die in her sleep, and her son will find her deceased. She had a similar traumatic experience as a child related to her aunt, with whom she was extremely close. The aunt, who also suffered from migraines, was on her way to the hospital for migraine treatment and suffered a heart attack that resulted in her death. FW shows significant physical and emotional resilience. She has been erratic in attending psychotherapy appointments because she feels they have not been effective in addressing her mental health needs. Despite her chronic pain and associated dissatisfaction with treatment interventions, she has persevered. The treatment plan for FW includes psychotherapeutic medication intervention and management to achieve a more stable mood after she is weaned off her migraine medication by the migraine specialist. Continued education about Topamax, Effexor, and gabapentin medications, the utility of adherence, and the reason for not yet initiating additional psychopharmacology. Continued encouragement to maintain engagement in online support groups and adjunctive psychotherapy intervention. Continued encouragement to see an EMDR specialist to build effective problem solving and coping skills relative to her past trauma and current life stressors associated with her medical and psychiatric conditions. Continued monitoring of her suicide risk, which is assessed to be moderate to moderately high given her severe chronic pain, which has been linked to an increase in suicidal ideations, suicidal attempts, and completed suicides. Currently, the client denies suicide ideation, is future-oriented, and has protective factors in place, including family support, access to multiple treatment interventions, therapeutic alliances, and encouragement to build others. Thank you for your time and attention during this screencast.